This is Jeanette Main shortly after she fell and broke her leg on Monday. She lay like this for 7 hours waiting for an ambulance. And this is her talking to us today from her hospital bed, where she described what happened.
Yeah, so we arrived at the hospital about 10 o'clock and we had to wait outside in the ambulance. At least I was warm and had some pain relief and things in the ambulance though. Then they sorted it so that as soon as I came into the hospital, they did an x-ray. But then I had to go and wait on the corridor for another, hour and a half, 2 hours.
Jeanette is the human face behind the data released by NHS England this morning, which gives a picture of how the health service is performing. There is very little good news in the figures. Once again, waiting times have hit record highs across a number of NHS departments in England. Nearly 6 million people waited to start hospital treatments at the end of October. More than 10,500 people waited over 12 hours to be admitted to A&E, and more than 8,000 people arriving by ambulance waited more than an hour to be handed over to the emergency department.
I have to say, every person, every member of staff has just been magnificent, so lovely. But I've spoken to a doctor this afternoon who I think she said she was from Romania. And she said that kind of wait for an ambulance just wouldn't happen.
In October, Channel 4 News filmed the discharge unit at this Northumbria trust. They were preparing to send Mary Swindles home after a fall. But NHS England has said that last week, on average, there were 10,500 patients each day who no longer needed to be in hospital, but who were not discharged. The pressures on social care in the community being felt across the health service.
There is some good news about what we've heard today. Over 150,000 more people started treatment last month in comparison to the same month last year. The average wait for diagnostic tests is down. So all that hard work by NHS staff is having effects, but the top line, the number of people waiting, well, we knew that was high, and it's going to carry on rising because most estimates suggest there are still several million people out there in the community who should be on the waiting list and who are not.
Today, as ambulances queued outside Coventry Hospital, figures also showed the highest number of 999 calls for any November on record, an average of around 1 every 3 seconds. And now there is Omicron. The numbers thought to be doubling every 2 to 3 days. Modelling from government advisors released last night said in one scenario, hospital admissions from the new variant could top 1,000 a day by the end of the year. Although direct comparisons can't easily be made with South Africa, they are reporting a sharp rise in patients with Omicron.
Almost a 255% of increase during the past 7 days in terms of the number of cases. And in terms of admissions in both public and also private hospitals, we are seeing also an increase in number of cases. And this is about almost 12% of increase when we look at the past 24 hours. That was as of yesterday.
They are not, however, seeing large numbers being admitted to intensive care, which may give some hope. But in the UK, nobody is complacent, with warnings that we are going to face another difficult winter.
Victoria MacDonald reporting. Well, I've been speaking with Professor Peter Openshaw of Imperial College London, who's also Vice Chair of NERVTAG, the New and Emerging Respiratory Virus Threats Advisory Group. I began by asking him whether he thought the measures introduced in Plan B were the right ones, given the strains on the NHS.
I'm really pleased that these measures have been introduced, but I think many of us wonder if they are going to be stringent enough to keep this really highly infectious variant under control. The rate of growth at the moment is very, very high. And I do applaud these measures, but wonder whether we're going to have to introduce additional measures.
Given that it doesn't seem to be killing people, is that perhaps why the government's holding back?
I think that's certainly one of the key things that we need to know more about is the severity of disease. I would emphasize that so far, we've only seen this disease play itself out over a matter of a few days. And many people don't get seriously ill until the second or third week. So I think it's too early to say how serious disease is going to be once it's replicating at high levels on our own shores.
The data shown yesterday at the Downing Street press conference appears to show a doubling time for Omicron of 2 to 3 days. What does that actually mean?
It means that this virus is capable of growing very fast indeed. With some viruses, some of the previous variants, it's taken a lot longer for the virus to double its numbers. What it means is that if there's one case today in a particular place, then in 2 or 3 days, that's going to turn into 2 or 3 more days, that's going to turn into 4, 2 or 3 more days, that's going to turn into 8. So within 3 doubling times, which could be as little as a week, you've turned a small number into a very large number. And within a few weeks, that turns into thousands.
It sounds a sort of cynical question, but if it doesn't kill, well, it is said that Omicron is relatively mild. Why are we worrying about it?
I think it's too early to conclude that it's mild. I think we need a lot more information about the way in which it presents clinically, and we need to see what happens as the disease develops. Remember that in the first few days, SARS-CoV-2 normally presents as a mild viral infection. It's only in the 2nd and 3rd week that we start to see the serious consequences of that infection. So it really is too early. We don't have enough clinical information to say it's mild. I think it'd be very premature to make that judgment at the moment.
When we look at the COVID numbers, 148 deaths in the last 24 hours, how many does it have to reach before more restrictions are brought in?
I think many of us have felt that 150 deaths a day is an unacceptably high number. I mean, I think if you compare that with, say, the number of people who die in road traffic accidents in a year, this is a really very, very high number indeed. And if you compare it with influenza, this is also a very, very high death rate that we at the moment seem to be tolerating. Many of us would much prefer that rate to be very much lower, but this needs public debate, really. What is an acceptable death rate? But to me, 150 a day is too many.
Professor Peter Openshaw, thank you very much indeed for talking with us.
It's a pleasure. Thank you.